So today we'll be discussing a very common topic concerning pediatric foot. I'm Dr. Ratnav Ratan, consultant pediatric orthopedics and sports injuries at 𝗙𝗹𝗁𝗀 Hospital, Gurugram. Flat foot in children is a cause of concern among parents and among pediatricians. It's actually a cause of a lot of apprehensions and anxiety in parents when they first see their child walking with a flat feet. So I'm here to bust the myths, to reassure them, to let them know the recent trends and the current accepted norms for their management. So let me explain you what is flat feet. So if you see, this is the model of a foot. So a normal foot usually sits like this, and there is a 3-point on which the forces are taken. So what happens in a flat foot is this arch here on the inner side of the foot, it disappears. So this is basically a collapse of the longitudinal arch on the inner side of the foot. So when the child walks or when a child stands, the foot is basically like this, where the medial arch is obliterated. So this is by definition flat foot. There are various components of it, where the heel either goes outwards, there is associated turning of the front of the foot, and there is shortening on the outer side of the foot, there is lengthening on the inner side of the foot. So these are basic components of the deformity. Now, to be honest, it has been seen over many years and with multiple studies that it is a normal growth pattern. Flat foot is not something which is abnormal. It is considered to be a normal growth pattern, and it is not considered abnormal till it causes symptoms to a child. So the largest study done was of thousands of kids, where the arch was studied, and it was found that every child is born with a flat feet. It is normal to have a child with flat feet till 3 to 4 years of age. In fact, by 3 to 4 years, at least 50% of children still have flat foot. By 6 years of age, usually 25% of kids may still have flat foot, and that flat foot may continue to be there till their adulthood. So the normal arches usually develop by 6 to 7 years of age. Even if they do not develop and the child doesn't have any symptoms, nothing needs to be done. Now what happens here is, in flat foot, this angle here is vertical, that this bone here is vertical. What has been seen over a period of time is that this angle gradually corrects on its own when the child keeps on walking barefoot. So if the child is allowed to walk barefoot, it helps to build the muscles, strengthen the muscles on the lower side of the foot, and it builds the arch. So the concept of giving insoles, various ortho tests, shoe designs, stiff inserts have not proven to be useful in any way, modifying this natural course of history of arch building on the inner side of the foot. So there is no scientific evidence to giving any kinds of inserts in kids. So there are some causes where the flat feet, which normally disappears by 6 to 7 years of age, may persist beyond that age. So there are high likelihood if the child is obese, is overweight, or if the parents themselves have flat foot. So family history has an important link to flat feet in children. Then if the children have extreme joint laxity, that means the joint itself are so lax that when the child stands, the joints open up and the arch collapses. So excessive joint laxity in children is again a very common cause for persisting flat foot, which is flexible. Now, children who have started wearing shoes early have also been shown to have higher incidence of flat feet compared to the kids who have been walking barefoot for more number of years. So early shoe wear is never recommended in a kid. So what happens if a flexible flat foot persists in adulthood? So studies were done in military recruits during World War II, and they have been found that most of them were asymptomatic, had no disability. They were as good as the other recruits who had arch on the medial side. So it is not a disability. Adult with a flat foot which is flexible and may not have any symptoms, and nothing needs to be done. So they can do every activity a normal person can do. So if you find your child to have a flat feet and you go to your doctor, to a pediatric orthopedic surgeon, what we usually do is to examine for a few things. The most important thing is the subtalar movement, the joint here on the back of the heel, that needs to be examined for stiffness, if it is mobile or not. We examine, we pull up the toe and see if the arch builds up. We ask the child to stand on the toes and see that if the arch builds. We examine for the heel cord contracture. The heel cord comes here. So if we examine the child and if the heel cord is tight, so such children are more likely to be symptomatic and may have difficulty running, or may even complain of pain on the back of feet. So these things can need to be evaluated. So if the flat foot is stiff, that means this mobility is restricted, there is heel cord contracture, so they may have some underlying problems. They may not be an idiopathic flat feet where we don't have a reason. So these stiff flat feet can be symptomatic and may need surgical intervention or even orthotics, various kinds of surgeries. So they usually have some problems where the bones are fused to each other, known as the tarsal coalition, or there may be a condition where the flat foot is hypomobile because of the laxity, because of the heel cord contracture. So, and sometimes the talus here may be more vertical than normal. So they may have a foot which is actually convex on the lower side, like a boat. So these are secondary causes of flat foot. So after examination, sometimes if the child is symptomatic and we see that the arch is not building, we may ask for x-rays. So there are some specific standing weight bearing x-rays where the foot is examined on an x-ray from the side, from the front, and we look for various angles if they are more than normal. So there are various angles which quantify the amount of the flat feet. So they may need to be done if the child is symptomatic and if the deformity is extremely severe. Smaller kids less than 3 to 4 years, we usually do not need an x-ray unless there are signs of a vertical talus or a oblique talus. So if you ask for treatment, no treatment is required if the child isn't complaining of any pain. Any child less than 6 to 7 years of age who is running around with a flat feet, no matter how severe it is, usually do not need any kind of shoe inserts or even exercises, just that we need to exclude a tight heel cord. Sometimes if the child is symptomatic and we have signs of some fusion of the talar bones and where we find some secondary causes of flat feet and something which causes tightness of the heel cord, they may need some kind of stretching exercises of the heel cord, some inserts to bring the foot in the normal position so that the gait improves and the symptoms decrease. There have been recent advances in treatment of flat feet, and some of the recent trends include putting in an implant in this space between the talus and the calcaneum. So what it basically does is to push the heel inside, but they are mostly done in symptomatic kids who have painful flat feet, who have semi-rigid or rigid kind of flat feet, and we try to push the heel inwards. It has complications, the risk of complications as well, but some of the kids do respond well to that. Kids who have severe pain, are disabled because of flat feet, have developed arthritis between the bones of the feet, especially those who are beyond 10 or 12 years of age, may require additional procedures in terms of heel cord lengthening of the outer part of the feet by cutting the bones, shortening on the inner side of the feet, some tendon transfers to rebalance the muscle forces around the feet, and that helps to decrease the symptoms. But they are mostly rigid feet who have underlying neuromuscular causes or where the bones are fused to each other. So to summarize, flat feet is considered normal. It's just like variation in the height of kids, just like the way physique differs. So that is how the shape of the foot may differ. Every flat foot doesn't need any treatment, and parents will be reassured that most of the kids, if just left alone, will improve on its own. Thank you.